Hi everyone, and welcome to Country Education Partnerships PD online series. My name is Mark McClay, and I'm employed by CEP to come to you today. I acknowledge the traditional owners of the many lands on which we meet and pay my respects to elders past, present, and any Indigenous peoples who we have with us today. The session goes for a maximum of 1 hour, and the program is recorded to allow you to review at your leisure. And we know a number of people actually prefer to watch the recorded one, probably to fast forward over this section, but we'll do our best anyway. So this is part 2 of session 3 in the autumn series, and I would strongly encourage you to watch part 1. It was an amazing session with so many valuable resources for schools. I would really highly recommend it. Also, we must point out that you can watch part 2 before part 1. There are no great character developments that you will lose your place by watching part 2 first. So, but I would strongly encourage you to watch them. We also just remind you to hop on CP socials if you aren't, Facebook and Instagram, LinkedIn. And if you like watching the CEO make a fool of himself with some videos, please hop on. We never know where he might pop up. Yes, Morris, nodding away there. Where he might pop up next. We're hoping to do a good one at the P12 Summit this Friday. Let's see who we can get online, but we never quite know where they could occur. We'll also remind people that the survey will be in the chat group towards the end of the session. We strongly encourage you to provide feedback. We also do have a few minutes spare up our sleeves today, so if you have questions along the way, pop them in the chat. We'll either get them answered live or the presenters can follow up at a later date if need be, but we will try and answer those questions. So thank you all again for joining. It's my pleasure now to pass over to the CEP Management of Youth Services and one of Victoria's finest Western Australian imports, to Morris Billy, to facilitate today's session. Over to you, Morris.
Thanks, Mark, and good afternoon, everybody. And I always love when Mark refers to himself in the third person with his videos, because that's how I feel when I watch them, but they are entertaining. So as Mark mentioned, welcome to part 2 of this series, and it's fantastic that we're looking at what kinds of support are available for small schools in our state. I think as CEP travels around the state, we often find that our small schools do a lot with very little at times in terms of resources and things that are available. So we're lucky that we've got a bunch of people this afternoon who are able to share some of those resources and things that are available for small schools as they navigate some of those challenges. So we're excited that we've got 4 great speakers this afternoon, and I don't think we should wait too much longer to hear from them and get a sense of what they are doing and what they're offering. And we'd like to start off with Kim Cowen, who's the project coordinator for the Centre for Excellence in Rural Sexual Health at the Department of Rural Health, Faculty of Medicine, Dentistry and Health Sciences at the University of Melbourne. I do love a long title, but I think that helps to explain a lot of the work that Kim is involved in and Kim does. And Kim, without further ado, I'd like to welcome you to the CEP podcast and take it away.
Thanks, Morris. It's a bit of a mouthful, that one, but rolled off the tongue nicely. So thanks for having me along today. So yeah, as Morris mentioned, I work with the Centre for Excellence in Rural Sexual Health, and we work out of the Department of Rural Health. We have spots all over Victoria in the Hume and Loddon Mallee regions, but I work out of the Shepparton office. And are my slides scrolling along there okay?
Yep.
I'd just like to begin by acknowledging the traditional custodians of the unceded lands from which we are all joining from around Victoria today. I'm here on the lands of the Yorta Yorta Nation and would like to pay my respects to their elders past and present. Yeah, as I mentioned, a bit about CERSH. So we are funded under a service agreement through the University of Melbourne, and we look after all things sexual health related in a workforce building capacity. So we work with schools in terms of we can give support to teaching staff. We're not in the position to be able to go out into classrooms, but we can work with educators. We also have a subject, we support the medical students in their sexual health subject that they do at the University of Melbourne, and we have a bunch of other exciting community and innovative projects that we get to be involved in as well. My main project that I work in is called the STIX test vending machine. So some of you might have seen that around. Always happy to talk about that. So hit me up with an email if you've got any questions at the end. But that's what I normally talk about all day. But today I wanted to talk a bit about relationships and sexuality education, RSE, which is a big umbrella term encompassing all of these different areas: sexual health and puberty, consent, respect, boundaries. Many different terms are all grouped in there under RSE. And what we know about quality RSE education is, well, there's a bit of an outdated myth that teaching young people about sexual health or sex will mean that they're more likely to go out and start having sexual experiences younger than if they didn't know this sort of information. But we kind of know now that it's just simply not true. In fact, the opposite is true. So when young people receive quality RSE, they're actually more likely to delay their first sexual experiences than and then when they do go out and start having sexual experiences, they're better prepared with how to do so safely and avoid unwanted situations, including STIs and pregnancies, and those situations that are more based on respect as well, keeping themselves safe. So education and knowledge, as educators, they're protective tools, so that if we give students the language to be able to recognise situations, to name their body parts correctly and help build their autonomy, then they're better prepared to be out there and making decisions that are going to be decisions that they're happy with into the future. But it is, this was a mentee that we did in another session, which I always quite enjoy this. The teachers were asked how they may feel about teaching sexual health, because many of the teachers had said that they were a bit reluctant around teaching relationships and sexuality education. And I'd love to know if you guys feel that you can identify with some of these sentiments. There's lots of different things here, like fear of backlash, fear of saying the wrong thing, keeping up to date. We know that a lot of the terminology is changing in this space, and there's a fear of offending. Maybe you've got your own personal discomfort or concerns about triggering a student or opening the doorway for a situation that you might not feel equipped to manage. And particularly in regional settings, we know confidentiality can sometimes be an issue. You might know these kids outside of school, see them at the basketball courts, that sort of thing. So it can create a different dynamic, and it is a unique topic area that many teachers don't sort of walk into the classroom feeling comfortable how to address it. It's often not explicitly taught in your pre-service education, and there's often not that many PDs where teachers are able to develop their skills and to be able to get comfortable with RSE throughout their careers. So but we do know that if you are an educator who tries to avoid this topic or just sticks to kind of the nuts and bolts areas of it, versus an educator who is comfortable with a wide range of topics and can focus their lessons more on the dialogue and the skills rather than just the facts, then you can build your comfort level and be able to create that environment in the classroom. So today we just want to acknowledge that there's very valid teacher concerns in this area sometimes, but highlight that the more confident and comfortable that you can become with this area, the more effective you'll be in teaching it. But it's okay not to have all the answers. You don't need to be an expert. The main goal here is to be able to guide students on where they can go to get the answers and to build their own sexual health literacy. So this really is something that happens from practice. You won't always nail it. If you make a mistake, it's okay. Acknowledge it, reflect, try again. If you have a colleague who's doing a really good job, ask if you can observe some of their lessons or get some tips. I don't need to tell you about classroom management, but setting the tone in your classroom at the beginning of the lesson about respect and the expectations goes a long way. And don't reinvent the wheel. There are so many resources out there. And I'm just going to talk a little bit. Please let me know how I'm going for time. But I did want to talk a bit about this program, the Achievement Program, which many of you may be aware of. This is a whole school approach that involves embedding health and wellbeing strategies across all aspects of school. Many of you might be familiar with it. There's over 700 schools, I think, in Victoria who are part of the program. But I'm just going to give you a quick overview of it. So it's the Victorian model. It's based on the World Health Organization promotion in schools. It's supported as best practice by the Department of Education, and it strengthens connection between health and education. So it does this by incorporating the Victorian Health and Wellbeing Plan with FISO 2.0. So FISO is the framework for improving student outcomes, which used to be literacy and numeracy, and recently wellbeing has also been added to that, which means now schools are required to incorporate a focus on different aspects of student wellbeing as a core part of not just the curriculum within the classroom, but a whole school approach. So broader than just what happens within the classroom. So the achievement framework is an option that schools have as one way to systematically embed all those areas into their school and meet their student wellbeing requirements. It's broad. It's not only about sexual health. There's a range of different aspects relevant to promoting healthy lifestyles. There's safe environments, healthy eating, active living, sun smart climate health. I think there's one more, but I know I'm just going to focus on relationships. So again, that's our umbrella term, incorporating sexuality, puberty, sexual diversity, and respectful relationships all together. So it's really just putting it in one place. All of the resources for the Achievement Program are free. They are on the Achievement Program website, or there's links to it through the Department of Education website, and it's supported by the Cancer Council. If we look at the relationships arm of it, it sort of goes into, you need to have buy-in from all levels of the school. So you get a commitment from your leadership teams to prioritise and support health and wellbeing initiatives. There's policies and documents and ways to support schools to create that healthy physical environment, a healthy culture where respectful behaviours are encouraged and supported by everybody. It's the curriculum, so it's integrated across various aspects of the curriculum. We're moving away from the old model of, you get the talk for 1 hour in year 9 and then it's never mentioned again. This is more integrated. There's support for staff and educators. We know that healthy and well supported staff are going to be more affected in their roles. And then there's ways to look broader across family and community partnerships as well. So creating those wider scope partnerships. It may sound like a lot of work, but honestly, a lot of government schools will already be meeting quite a few of the criteria, and then there's just a framework there that can help you sort of pull it together, and a bit of a strategy for meeting the other criteria. So that is well worth a look if your school is interested in that. Also, I would encourage you to jump onto our website, the Centre for Excellence in Rural Sexual Health. Just pop that into Google. We spent, somebody's project last year or the year before was to build a lot of educational resources. So if you navigate through to the health promotion and educational resources page, this Busy Youth Workers Guide might be really useful for people working in secondary schools. And the teacher resources here are all linked to the Victorian curriculum. So if you scroll through, where am I? I've gone a bit too far, sorry, go back there. If you scroll through, there's links there that you can click on, and there's free resources that link to all the aspects that are the teachable parts of the curriculum. So well worth a look. We also have a resource library if you are doing, if you're working in the older classrooms where you are doing like the condom demonstrators, there's a game there that goes with it, and menstruation kit that is a good demonstrator if you're teaching that. And we also have a range of picture storybooks which are great for the younger years as well. So if you're interested in borrowing any resources from our library and you're in the Hume or Loddon Mallee region, get in touch. We can send those out to you in the post, or if you happen to be near any of our sites. As I said, we've got staff dotted around the state. And this last one that I really wanted to talk to you about today is another educational opportunity. So CERSH have partnered with Sexual Health Victoria, and we have bought a range of different modules focused on teaching sexual health. So there's supporting RSE in school settings, answering tricky questions with confidence, and teaching about contraception, STIs and BBVs. These modules, if you're interested in completing them, just jot down that email address there, or I'll put up my email address at the end. Get in touch. There's a code I will send you. Jump onto the Sexual Health Victoria website and just enter the code at the checkout. They are altogether cost a couple of $100 to do them ordinarily. So it's a nice little saving that we're happy to pass on to you today. You can do them for free. You just jump in and do them at your own pace, and they take a couple of hours. I think all three of them would take about 8 hours to do. So it's a handy little saving. And there is the website, there is the email address. So please get in touch. Would love to share that with you.
Thanks, Kim. I just jotted down a couple of points, and there was a question in the chat box, which I'll add to that. And one of those was around resources disparity in our schools. And I guess some of our larger schools often do have a school nurse or a doctors in schools program and a dedicated wellbeing coordinator. I'm also aware that a lot of our small schools, that one person wears all those hats, as well as teaching and sometimes being a principal and having to do yard duty and gardening and everything. And it can be a challenge in that space.
Absolutely.
And it probably links with that question that someone just put in the chat box about some of the resources and trying to adapt them when you've got a classroom, particularly, say, if you're teaching grade 1s to 3 or grades 3 to 6, because in a smaller school, they have combined ages in a classroom and the ages can be very different. I'm just wondering if you've got a quick comment on that and adapting the resources in that space.
Yeah. My kids go to a small school with only 60 kids, so I understand there can definitely be a wide range of ages within the one classroom. And I think that a lot of these topics are really best pitched to maturity levels rather than your chronological age. So the teachers will be, a good judge of who's appropriate to have in what groups and what you're covering. A lot of in the early years, you're really just talking about body safety, your respect for relationships, how to be a good friend. It's not necessarily explicitly like sexual relationships. They're all just good relationship skills, and they're transferable from, right from your little ears all the way up the years. So I think that teachers are really good at adapting and just knowing like what's appropriate in their classroom, like who they've got and what the maturity levels are like in the classroom.
Excellent. Thank you for that. And as we said, we've got a fair bit to get through, but if you've got any other questions or comments to follow up, as Mark said, we might have a few minutes at the end, so pop them in the chat box and we can get to them as we go on. But thanks very much, Kim, for joining us. We're going to move on now to Zoe Nikakis from Orygen, and we're getting into the space of digital technology. I've known Orygen for many years. They do amazing work, and we're going to find out a bit about Scroll Safe now, which I've had a look at some of the resources and stuff online, and there's some amazing content there. So without further ado, Zoe, welcome to our PD Online this afternoon, and thanks for joining us, and over to you.
Thank you so much. And I'm just confirming everyone can see my screen there. Great.
Yes, we can.
Okay, wonderful. Thank you. So my name is Zoe Nikakis. I'm a Senior Project Officer in the Knowledge Translation team at Orygen. And I'm here to talk about our Scroll Safe project, which looked at the intersection of social media and youth mental health, which is a bit of a hot topic. And I'd, of course, like to acknowledge as well that I'm calling in from the lands of the Bunurong people, and I'd like to pay my respects to elders past and present. And for those of you who are unfamiliar, Bunurong country, I'm in the west of Melbourne, and it stretches so far into the east, and I'm always so amazed by the geographical location that it covers, and it's just such a beautiful part of our state. So highly recommend a visit if you're ever venturing out towards the water. So I thought I'd kick off with a bit of information around social media and youth mental health. Obviously, there's a lot of conversations about it at the moment, and we know that there's increasing evidence linking high social media use to poor mental health outcomes. But what does this really look like? So Orygen and Mission Australia did some research last year that found 97% of young people are using social media every day. and about 38% are spending 3 or more hours online per day. So that's where we consider social media use as being quite high. And the eSafety Commissioner also did some research recently that found 44% of young people report having negative online experiences in the past 6 months, and almost 1/3 of these are related to bullying in the school setting. So while social media and phones might not be allowed in school, we see that there's a real connection with what's happening online to what's happening in real life for the young person. And although this is happening, 90% of young people are still seeking out positive experiences, interactions, and relationships online. So really looking for that social connection, which they can get from social media. But evidence suggests that moderation is key, like with a lot of things. And the Orygen Mission Australia study last year found that moderate use can have similar and sometimes even better outcomes than low social media use. And that is because of that social connection that can come from it. So high users, young people who use social media for 3 or more hours per day, report higher levels of distress, feeling less control over their lives, and a greater likelihood of going online when feeling lonely. Whereas lower moderate users have lower levels of distress, they feel more in control, and they're more likely to engage in hobbies or reach out to friends and family when they're feeling lonely. I thought I'd put on here a couple signs of problematic social media use. So that's when social media is interfering with day-to-day life. So that might be things around academic performance, relationships, engaging in social activities and hobbies, and just general health and well-being. Some common signs include when social media is the young person's highest priority, and their mood might change if they can't access their social media. So if they're not allowed to be on their phone, they might start to feel quite anxious. We might see challenges with focus, exhaustion, and fatigue, maybe because of high screen time. There might be a decline in engagement in social activities, and we might see their worldview being overly informed by social media. And that's where we see the manosphere coming into the discussion. But I do have a note on here that these common signs might be exacerbated by other things going on in the young person's life and vice versa. So it's really important to consider the young person as a whole and everything that's going on for them. What can we do? We can spot the signs early and check in with the young person if we notice a decline in their well-being. And this might be being quite curious and not judgmental in exploring what really motivates the young person to be online and what really drives them and why does being online fulfill them in that way. We can encourage other pathways of online engagement. We can think about the broader context around the young person if they're experiencing other things that might be contributing to poor mental health. And then we can empower the young person to really reflect on their own experience and think about whether they need extra supports in this space. Which brings me to Scroll Safe. So Scroll Safe was a project that we published late last year, and it was developed in partnership with the Victorian Department of Education and the Department of Health. And it's a set of resources for secondary school aged young people. And then we've got some resources for parents, for teachers, and for mental health practitioners in schools. So the resources are really to support young people to use social media in health and safe ways, but we identified schools are in a really good position to help support this as well. I'll do a quick run through of what we have produced through the project. So we've got a guide for teens that is like a little bit of a printable booklet with some information around how to stay safe online, and then a TLDR flyer that has the 10 tips there. And then we also have a digital wellbeing plan. So this prompts the young person to think about their online experience and things that they can do to help support themselves online. I don't expect you to be able to read all of the questions, but some of them are like, how will I set boundaries around my time online? How will I track my progress and wins? It's a really great resource to get young people to fill out, and it helps them stay accountable as well. There's some guidance for parents around having conversations, and a great little 2-minute 20 video that helps parents understand this topic from a young person's perspective. Some information for teachers. So we've got a fact sheet for secondary school teachers that has some facts, of course, but also some information around how to build safety in the classroom on this topic, and some signs of problematic social media use that might show up in the classroom and around the young person's social and emotional well-being, and through their academic and behavioural aspects. And then we've also got a classroom activity that's actually mapped to the digital safety and wellbeing curriculum for Year 7s and 8s and 9s and 10s. And we really see this being done in kind of pastoral care wellbeing classes. And it also has some conversation starters that can be turned into a lesson with some timings and materials required, all in that resource. Mindful of time, so I'm going to whiz through this. We also have some clinical guidance for mental health practitioners in schools that steps through the 3 different tiers. So Tier 1, mental health promotion and prevention; Tier 2, more early intervention for cohorts that might be at risk of problematic social media use; and then Tier 3, targeted support for young people who are engaging problematically in social media. This is the QR code to the hub that has all of the resources on there that you can download. But I also just wanted to flag the Safe Socials website, which is another great Department of Ed resource that has all of the resources linked in there as well. And I think that is me bringing us back onto time.
No, you've done well. Zoe. I think there's a couple of just a quick things there that I would like your response to, if possible.
Yeah, absolutely.
I know that that the research says that you've engaged very closely with young people putting this together, which is fantastic because they've had an input. And also, I think that challenge of that transition stage between primary and secondary about when is the right time to have these conversations and how to introduce them with parents and schools. Our kids don't just magically appear at secondary school and get thrown into this space. There's a lot that happens before that. I'm just wondering, I know your resources are aimed at secondary, but have you got any thoughts in that space just leading up to that?
Yeah, and it's a good question because obviously with the social media delay that the Australian government implemented late last year, that stops young people from accessing social media until they're 16. It was a bit of a conversation as well. And we find that these resources we really see as a tool to help young people build their digital literacy skills even before they're online. We know young people under 16, at least at the moment, are still accessing social media or online spaces that mimic social media. So we find that they can still be a really valuable resource in those earlier, 12, 13 age groups where they might not be yet accessing this stuff, but it's good to help get them thinking about what their lives might look like online and how they can keep themselves safe and well. Yeah.
And I think the resources do that. I had a look at them and know them and know that they're embedded with what young people are feeding back and stuff. And I think that concept of, and we've got a group of young people who talked about this last week, who said what they want is the opportunity to have more of those conversations, particularly at secondary school with their teachers, as opposed to being delivered to, but having those conversations. I think that they can be a real gold in this area where you can just open up the levels of communication and just have great conversations that you can share experiences and knowledge with.
Yeah, absolutely. And just frank conversations where there's some honesty and safety in that.
Yeah, absolutely.
Thanks,
Zoe. Again, if anyone's got any questions or comments to follow up, I think there might be a further comment in there, which we will get to in a moment. But we might go to our next speaker first, and then if we've got a bit of time towards the end, I think we will have room for some of those conversations to continue and those questions. Mindful of time, I'm happy now to welcome Lucy Surace, who's the Return to Work and Recovery, or is with the Return to Work and Recovery team, Employee Safety, Wellbeing and Inclusion Division within the department. And again, quite a bit in that portfolio and a few things to discuss in that space. So Lucy, welcome to the conversation and thank you for joining us, and I'll hand it over to you.
Thank you so much for having me today, guys. I'm really looking forward to presenting. So yes, as already introduced, I'm from the Return to Work and Recovery team. I'm just going to talk a little bit about what our team does and how we can hopefully, yes, support schools. So can everyone see the slide show deck? Okay, yep. Fantastic. So just setting myself up here. So managing workers' compensation claims is complex. It takes significant time. As a result of claims, principals and other school leaders are often pulled away from teaching, learning and supporting students. The Return to Work and Recovery team was established to provide a dedicated group of specialists to manage claims on behalf of schools and regions. We handle the full cycle of the claim, which includes lodgement, managing claims in EduSafe Plus, coordinating with injured employees and their treating health practitioners, resolving issues and supporting return to work and planning. This centralised approach to claims ensures consistent, effective claim management and reduces administrative pressure that schools face when they're managing a complex claim. The key benefits is that leaders can stay focused on learning, wellbeing and school operations. From May 2023 to February 2026, the Return to Work and Recovery team have supported 603 claims. This program is funded through the Employee Mental Health Reform for principal class and complex claims, and the VSBA for small schools program that runs in schools. The team is already managing, so this is our criteria on how to refer a complex claim. Our team is already managing claims under this criteria, and it's about providing clarity for those referring claims to our team so it's clear where we can support or where it may not be appropriate. So we've got 3 tiers here. First tier is just temporary support, where we may need to just intervene briefly, set the claim up, get things back on track. Tier 2 is they're significant but not critical claims. These so there might be work-safe involvement, conflict of interest where there's no one appropriate at the school to be the return to work coordinator, and our team can take over from that due to interpersonal conflict. Matters involving complex conduct or performance concerns, and as I said, interpersonal issues. And then tier 3, where there might be an employee that's at risk, injury or illness is identified, and there's complex mental health and self-harm issues. The injury is could fall under a sexual assault. There's critical incidents where multiple staff may have been injured, or there's reputational risk, which includes media, serious injuries or death, which hopefully that's not the case. But I'm just going to read through a case study now of kind of where we've intervened. So balancing recovery and return to work following a critical incident leading to 28 workers' compensation claims. We assisted a school to manage a primary school teacher. Oh, sorry, hang on, that is the wrong heading. That's a different case study. Ignore that. We assisted a school to manage a primary school teacher with a knee injury, with a secondary psychological injury. The school's business manager just recently resigned effective immediately, and the principal had limited work cover knowledge or capacity to manage this claim. The actions that were taken were a face-to-face meeting to ensure that we understood the school's dynamic and what the workers' pre-injuries duties were and what reasonable adjustments could be made while the worker was recovering. Return to work planning took place and ongoing communication and monitoring occurred, maintaining regular communication with the employee, principal and psychologist. The outcome, the employee was successfully returned to work in graded capacity, progressing steadily towards pre-injury duties. The school met all legislative obligations along with return to work planning, right payroll processes occurred to ensure that the insurer agent was able to process workers' pay in a timely manner, and an ongoing relationship with the principal and school were assisted where might be needed to manage future work cover cases and sustaining a supportive workplace culture. The workers' compensation is available. So there's actually two teams. There's a workers' compensation team, which is kind of like an advisory. They provide specialist return to work information across the department, and the return to work and recovery team. So what's the difference? The workers' compensation team specialists advice to school-based return to work coordinators. They are a point of contact for workers' compensation escalation, refer complex claims to the return to work recovery team. Compared to the return to work recovery team, who work directly with injured employees and their workplace managers to prepare return to work plans and coordinate actions. They manage claims on behalf of the schools and region. For schools seeking support with claims, we recommend contacting the workers' compensation team first as a primary point of contact, and they can help resolve questions or redirect to the return to work and recovery team. Thank you, everyone. That is me.
Thank you. I would have to say that is well outside my brief in terms of my understanding of the way schools operate in that space. So I might throw over to Mark. Mark, have you got any comments or follow-up, being reasonably fresh out of a school environment when it comes to that very tricky area of return to work and recovery?
Just that the assistance is incredibly valued. For small schools, it'll be one of those things you may never encounter. And then you do out the blue and you don't really have the expertise or necessarily be able to give it the attention to detail, because generally you're still the principal for the school running the school. So I know from first-hand experience, getting that support is absolutely invaluable. And the different types vary greatly depending on the circumstances. So there are some that are straightforward and some that are very complicated.
That's right. And I think just like our team at the end of the day wants to take that pressure away from schools, because we understand and appreciate how complex some work cover claims can be. So, yeah.
And Lucy, obviously, if you're not sure and it's a bit of a grey area, when in doubt, reach out and get some information.
Absolutely. And we're always like happy to help. We really do have like kind of like that open door policy. So like, please, if anyone's listening to this and has a curly claim or like some questions, I'm sure we could definitely be able to assist in any way.
Thank you. Thank you so much for that. And thanks, Mark, for your input as well. We are doing well with time, so we will move on to our fourth and final speaker. And it's great that we've got Lauren Turnbull joining us this afternoon. Lauren works in the mental health promotion and incident response and recovery specialist space, leading interventions based on health practice and evidence-based approaches to enhancing organisational health, safety and well-being promotion. There's a lot there, Lauren, and I'm looking forward to you sharing your experiences and resources and supports in this space. So, Lauren, over to you, and thanks for joining us.
Thank you for the introduction, and thanks to everyone joining us and listening back on the replay. I am really happy to be here and discuss the employee mental health reforms that are specific to all staff, but we will specifically be speaking about staff in small school settings and in different roles as well. And I work in the same division as our previous speaker, Lucy. So we have a big division in Central called Employee Safety Wellbeing Division, and I'm in the Employee Mental Health Reforms team, and my role is around a promotion of the resources and services and supports that staff can access, and really helping schools and principals in promoting those to staff in a way that really helps engagement and can break down barriers that can exist to help seeking. So that is me and why I'm here. So I'm going to shoot through a lot of resources and services you can access, and you can look at the slides in more time if you wish to, and reach out to me if you'd like to have any of these unpacked, because it is a rather big menu, but we don't want you to have to remember them all or know where to go at any point. We are very happy to act as navigators through these services and the systems and teams that you might have and access to, depending on what you are experiencing and what your school is experiencing. So this slide here shows us that we have lots of different programs and services under the employee mental health reforms, and they really focus on a whole range of needs of staff and schools that range from the proactive space, where we're getting in early and we're preventing escalation or preventing mental injury, through to the reactive space where incidents might have escalated or symptoms escalated, and we need those services there as well to act on that responsive or reactive end of that spectrum. So there is something there at any stage, and we do really practice a no wrong door approach. So if you came to us and described sort of your problem, then we would help you navigate to the solution, because as I said before, there's a lot of resources and teams that can step in, and we are there to navigate where you want to be, where you want to get to. I'm going to flick through those two, because what I want to focus on first up is this poster, which you can access on the Principal Health and Wellbeing page. There's copies there, but this poster encompasses all of the principal class wellbeing supports, and some of them are internal teams and policies and supports that can immediately step in, like the return to work is there that Lucy just mentioned. We've got other services that are on the proactive end, like Principal Mentor Program, Proactive Wellbeing Support, Peer Group Support Program, which is a fairly new one. And like many of these services, this one started as a pilot and has now expanded to the whole state. So this is how many of these services start. They're piloted, feedback and drives the expansion. And so they're really informed by staff and adapted to meet the needs of the staff that they're aimed to address. So peer group support is one that we would really love more principals to have access to. And the reason I mention it is that we do have lots of Prins class staff across the state who are engaged or are waiting for a group size being enough for them to engage. So if you're interested, you can use that email there to ask more. Another one to highlight is the Early Intervention Program. This is a great one to talk about today, because the Early Intervention Program has crossover between principal class staff and small school staff. So if you're a registered small school, all your staff can access the Early Intervention Program, and no matter what their role. So that's really great to highlight to your teams and your peers in those school settings. And it's also relevant for all staff in specialist settings. You're also all eligible for this program. And Early Intervention Program offers extensive psychology, dietitian, physio and exercise physiology appointments that are funded, and you can use that as well as the other employee wellbeing supports that you might already be aware of. So that's a great one to look into. That brings me to the universal supports that all staff can access and can complement the previous page that we just talked through. So a lot of these services work well alongside each other. That's really good to remember, that we don't have to choose one. It's not a one and done. We could use many. We could use them in combination or to complement the needs that we have as we go along, because they're all different and they've all got a different purpose. So these ones here, this is our universal offering for all staff, all DE staff members. and there's 8 free and confidential services here on our EWSS wheel. Most services you can get 4 sessions per issue. So that means that if I was originally asking for counselling to talk about workplace stress or job-related stress, but then I wanted to eventually, we discussed things and then we realised I wanted to talk about relationship or interpersonal conflict in my private life, or you know, you can move between issues and talk about them at the same time as well, and then get granted further sessions. So it's very generous and holistic that way. Legal support offers 2 sessions and manager support is unlimited. The manager support is really great for staff who are juggling lots of roles in their school and, you know, I guess having to do many things on any given day. There's lots of leadership skills there. There's lots of need on you at any given time. So manager support is a popular one to help staff develop their professional and personal skills and to be able to do the best they can in that role that they have. And these, just getting ahead of some questions that do often come up when I do present these to schools and regional staff. These are confidential. If you were to access these by calling through to Converge or the other providers of the other programs we have, there's no data sent back to your employer or your manager. The data we do collect is around how many hours and how much utilisation of the service generally, and it can be broken down to areas of Victoria, but not, you know, specific enough to know which school that had come from or which area and what was discussed. That's certainly not shared back to the Department of Education. And we also have these specialist helplines, that these were created to reflect the diversity of our workforce in Department of Education, and that sometimes people want to access help that has a lens of the experience that they're seeking to, you know, discuss, or has that shared cultural or you know, identity behind it. So, for example, you could call the Aboriginal and Torres Strait Islander specialist helpline if you wanted to speak to someone with that ability to create that culturally safe environment for a conversation, or you could to someone who is also a First Nations person. And for domestic and family violence hotline, elder care and disability and carers specialist helplines, they would be used for to be directed towards resources or to have counselling around that topic if that's something that staff members wanted to speak specifically about. So they can use these helplines or the other services on the other wheel that we discussed. And this is how you can access those. That's very easy to get into those services, and this is for Converge for the EWSS. The early intervention program I talked about before for small school staff and PRIN class and specialist settings, that's a different service, and that phone number was in that other poster that was on the slide, the Principal Wellbeing poster. Also really good to know that staff can access the crisis counselling themselves by calling Converge and ask for an urgent appointment. This is really great to know if your staff members have experienced something like an incident at school or in a community, and often staff are coming in after a weekend and sharing with their peers or their manager that something's happened over the weekend and they just want you to know. You can say to them, would you like me to set up a phone call for you? Would you like this? Did you know you can call this number anytime? And they can organise a time for a call back, or just have the next available call back, which would be within the hour, and then speak to someone around, just helping them regulate and move on to their, you know, accessing a safety plan and making plans for their recovery, and then referral on to another, you know, counselling service or other service that meted their need at the time. Really good to know, I think, that that's available. Similarly, schools are often using on-site support after an incident. So this could be something that's happening in your community, you know, that impacts your school, or it could be something that's happening to an individual in your school, or an incident of violence, for example, in your school setting. This is where you would ask Converge for an on-site clinician, and many schools and people listening might have already used this service. This is where a clinician would come on site and take, you know, confidential appointments for staff, whether they're impacted by that incident or just wanted to access someone and now they're available and it's easier because they're on site. So that's really popular for the staff who might be in rural or regional settings, and, you know, that travel time or that access is a barrier to receiving support. and can really complement, as all of these supports can complement the toolkits that staff may already be using really well. We might have really good wellbeing because we use our toolkit and our support network, and this can form another prong to that, using these professional services that are outside of your peer and family and friendship networks to give you that objective and professional lens over talking through your response and your impact from incidents or other things that are challenging. So really good to just have that in mind, that these can complement what's already working well or fill a gap for a need that might not be yet being met. And critical incident support is one case where a principal or manager will know that a staff member has access support, because when the on-site support occurs, the clinician will have a list of names and what time those staff members are seeing them, and the principal or manager of the site will see that so that they can cover that person or help with logistics. But otherwise, there wouldn't be names shared and it would be really confidential. And the peer group support we did talk about before, but this is a way you can access that. This is where we have a facilitated group session for principals to learn from each other and benefit from that peer interaction, and have a facilitator to keep that conversation, goal focused and encourage sharing. That's really great for Prince who might not already have that built into their professional network already. I think we're pretty much at time, so I will leave these slides with you to look through because we've discussed that. I've left a link of really helpful supports and PAL and school update links there, which we love, and my details there at the end.
Thanks, Lauren. That was really, really interesting, and it matches up with I think some of the feedback we've been getting from some of our rural schools about how important those supports are when that some communities don't have a lot of local support, if some don't have any at all. And when a school in a small rural area is sort of the hub of that community, lots of things impact the school indirectly, whether there's a bushfire or a flood or something in the community. Schools are central in those areas, and our principals and our school people do amazing work, but sometimes they put themselves last when it comes to looking after themselves and reaching out to their community and other people. And I think those resources that you shared show exactly just how important those resources and those opportunities are, and how we strongly encourage people to reach out and access those services available.
Thanks, Maurice. Yeah, absolutely would reflect that, and we get a lot of feedback from school staff where they reflect that it's really helpful to do so. They see it as a sign of their building up their professional skills, and they do this help seeking proactively to maintain their level of satisfaction with their role and things going on in their personal life as well. So yes, thank you for that support.
Thank you. And I just feel like with all our topics today, and Mark and I have been around for a while, and when we think about when we first came into the education space, about what little there was in the wellbeing space and looking after each other and supportive, and how much work we've done, particularly in this state, and the department has done. There's so many wonderful things out there, and today's resources have just been an example of what's available and how we can navigate that. So thank you, Lucy. We've got just a couple of minutes, and I just wanted to refer back to a comment that was in the chat box. And Zoe, if you're still with us, we did briefly touch on those resources with about online safety and talking to kids of a primary school age. And there's some stuff there about the Safe Socials website also has a resource for parents of primary school students to speak to them about online safety, which I think is fantastic because, as mentioned before, our kids are being exposed to a lot of this stuff at a much younger age, and being able to have those conversations is critical, and when they come up, and not shying away from them. So, Zoe, I think that sort of backs up what you were saying. Zoe there? No? Can't hear it, so I'm presuming Zoe is deeply engrossed in what I was saying and is not able to join us. But again, if anyone's got any other questions or comments, I think, she is here. I've just read her message, so it's not working. So anyway, we will continue with our conversation. If anyone else who's joined us has a question or a comment, you do have a minute or so to share that. But I did want to say also, even though Zoe can't join us, if you look at the Orygen website, what really interested me was the amount of research that they do. And there's some amazing topics that Orygen are doing research on and publishing information on that will directly impact on the work schools are doing. There's some wonderful research currently being undertaken about eating disorders and the impact that it's having on young people and families in our communities, and particularly the increase in eating disorders amongst young men. We don't have enough time to go into that because that would be an entirely new podcast. But again, check out the website at Orygen, and there's a lot more information and links available there. On that note, I will throw over to Mark. Back to you, Mark.
Thank you, Morris, and thanks once again to everyone who presented today. This session, like part one, I think will become a very valuable resource that we will constantly refer principals back to. And I will say the small school principal role often is very much the broker role, where both for other principals, teachers and parents, your one of your key roles is to support and to provide their brokerage and link them up with the supports that are available. And I concur, agree with you, Morris. Back in my early years as a principal, it was a lot harder to find those supports and resources around. So we thank people dearly, thank them all for their last slide where people put their contact details and things. It's really valuable. So the fact that these sessions are recorded and often viewed at a later date, I'm sure you'll get people reach out. Just before we finish up today, a promotion for next week. Now, it's no joke, it is on April 1st, but it is in the afternoon. And our very good friends at Maths Association Victoria are back. They present for us each year, and we're really, really excited to have their session. Not just because they take it over and run the whole thing and we put ourselves in their hands, because their content is so incredibly valuable. So next week, the title is Connecting Country Classrooms, Ready to Use Mathematics Professional Learning Activities. And there was a couple more lines with that promo, but I thought that was long enough. We don't know who we're going to have yet. We've been in touch with the CEO, Jennifer Bowden, who's fantastic, and he'll let us know very soon who we've got. But that just adds to the suspense. They're always brilliant sessions, and one's highly sought after by all teachers, but especially those who are mathematically inclined, and probably for those who aren't, because it simplifies everything and gives you those resources. So on behalf of CP, we thank you for joining in today. A reminder that the survey is in the chat line. If you wish to give us some feedback, we always welcome it. We thank all our presenters again today, and we really look forward to seeing you all next week. And we finished 3 minutes early today, so there you go. Thanks, everyone.